Oh, my groin.
Oh no, Chase, what happened?
I think I pulled my groin.
We gotta get you some help fast. Groin strains involve the adductor muscles, which are on the inner thigh or medial thigh here. They often occur when we have overstretched into abduction, taking the leg away from our body. So the last thing we wanna do is take someone's adductor muscles and stretch them all the way out. We wanna improve the tolerance and resilience of that muscle and tendon to any range of motion into abduction. So if Chase just injured his groin on this right side, I'm just gonna gently hold his leg right here, have him totally relax and say, Chase, just let me hold your leg. Let it hang in the air. And so I've got control here. Now, if you've got physical contact, you use your body as the rehab provider, and you just have the injured member gently squeeze in. So Chase, go ahead and gently pull in. Do not cause any pain. So you need to be at maybe 50 to 70% of your maximum effort, Chase. Now, if you don't have somebody there rehabbing you, you can just get a big pillow and put it between your knees and gently squeeze that pillow, or a ball, an inflatable ball you can put between your knees and gently squeeze that. You just relax every 5 seconds, Chase. So you'll hold it for 5 and then relax for 5. And we're just working on the ability to contract that injured muscle and tendon. Now, as you get better at this, we want to increase tolerance and decrease pain. So what we're going to have Chase do is actually hold that for 30 seconds. So we're going to do a prolonged isometric, but still at the same effort level. So I only want 50 to 75% of maximum contraction. So if they're struggling with that and you see pain on that person's face, you ask them to back it down a little bit. So Chase, I want you to back it down 25%. Good. So you can still feel that muscle contracting. I still feel him pulling his leg into my hip here, but he is not causing pain. Now Chase, relax. I am going to gently take your leg out to the side. I don't want you to feel any pain from this. So you let me know. Are you pain-free right here? Okay. From this position, we're gonna work on stretching those muscles out and contracting them from that stretch position so they can tolerate it more. We're gonna do the same thing. Go ahead and contract into my leg like you're pulling it towards the center of your body. We're staying shy of pain, and we're working on first 5-second holds and then increasing from there. We can work up to 30 and 45-second holds here. When you're getting up into that 45-second hold range, you should actually see pain decrease over the course of those 45 seconds. So go ahead and push into me. Good. Keep that steady for 45 seconds, Chase. You should feel your pain if you're having any come down. You should not feel it increase as you sustain these holds. And after 45 seconds, he would relax. Now we would then continue to increase the range of motion until that athlete tells you that that's their stopping point. So if the injury just occurred, they might only be in 30 or 45 degrees of hip abduction or away from their body. And that might be where you stop for the day or even a couple days. And then each time you come back to rehab, you're trying to expand that range of motion a little further. The next level of exercise, once they're really good at tolerating that, would be something like an modified adductor side plank. We're gonna show you what that looks like. This is the modified Copenhagen adductor side plank. We're working on building tolerance to contracting those adductor muscles and get them ready to get you back on the field, where they have to have a lot of strength in concentric, eccentric, and even some isometric contractions during the course of your movements. So Chase here is holding this for at least 30 seconds, then building up from there. A way to advance this, one, is to actually do pelvic drops. So instead of just holding it straight, he's gonna drop and lower his pelvis down and then pull it back up using those adductor muscles. Now, you do not do these on patients who have a lot of pain or irritability to their tendon injury. Go ahead and try that for repetition, Chase, and then back up, and then drop, and then back up. Now, Chase, you can take a rest for a second. So as that person is improving, maybe it's even a mild strain, and they're able to tolerate something like that, that's how you can increase their strength very quickly. Now, Chase, show the full Copenhagen. So if I've had a member with a groin strain, I'm not putting them back out on the field until they can do a long leg Copenhagen plank. So he has his foot all the way there. There's height between his knee and whatever the mark is, whether it's a bench or a table, and he's able to sustain a 30-second plank. Now, if you want to advance this and get into the full return to play protocol or even a preventative protocol, he would take the bottom leg and do scissors up and down with it. And that's going to work both hips. So you can do this on both sides.